During my ethnographic fieldwork in northern Samar, I have focused mainly on medical pluralism. In other words, how the Waray use both conventional, often called biomedical or formal medicine, as well as complementary and alternative medicine, also called, in the context of the Philippines, traditional medicine. I will apply my ethnographic data to a well-known theoretical model of medicine as a cultural system. This was developed by Arthur Kleinman, an American psychiatrist and medical anthropologist, which allows for a systematic analysis of the impact of culture on sickness and healing systems. Before I explain that model and apply my findings on it, I want to quote Kleinman, who warns us that medical systems are both social and cultural systems. They are not simply systems of meaning and behavioral norms, but those meanings and norms are attached to particular social relationships and institutional settings. To divorce the cultural system from the social system is clearly untenable. Most healthcare systems contain three overlapping and intersecting social arenas. The first one is the popular sector. This consists of a person's family, friends, neighbors, relatives, co-workers, in summary, a person's social network within their community. The second arena is the professional sector that encompasses those who work in the formal healthcare sector, the Western-trained or biomedical professionals. This would include doctors, nurses, midwives, pharmacists, and lab technicians. The third sector is the folk sector. Kleinman places here the non-professional healing specialists. It is important to remember that there are points of overlap between the three sectors. This is also the case in northern Samar. Matthew told you about Fredo, who is a midwife employed by the government to provide care for pregnant women. Fredo is also a faith healer and performs healing rituals on his days off and is a constant advisor to community members. The intersections will become very clear in the mental mapping we conducted in the province. In addition to participant observation, I have also led on creative and participatory activities with our Waray informants. In her fieldwork among Cypriot refugees, Dr. Lisa Di Comitis had already used mental mapping, also called sketch mapping. I facilitated sketch mapping with 40 research participants in northern Samar, some of which you can see here. These maps act as spatial data collection tool, and we were interested in learning about the locational experiences of the inhabitants of rural Philippines. This enhanced our understanding of how the Waray make sense of health and illness and gave us a privileged insight into their health-seeking practices. It helped the Solas ethnography team to understand the unwritten routes of healthcare seeking, and the drawing of the maps triggered a flow of information about local healers. These cartographies of rural health represent individual spatial narratives of healthcare providers. But in analyzing all 40 maps as one dataset, we clearly see that the Waray do not distinguish between the three health sectors. The mental map gave us a good insight into the medical pluralism in northern Samar. With medical pluralism, I mean that more than one medical system is employed or that both medical and traditional approaches are used. A range of healing practices can be observed in the two Solas hubs. There are well-known institutions and healers within the communities whom people seek healthcare from, depending on their concerns and symptoms and how they perceive what they need in terms of care. In that sense, Harani, Laan, Paglikay, or care is near. The Waray have a very clear understanding of the different categories of traditional healers. We have the albularyo, or the herbalist, or what would be considered to be a general practitioner among the Philippine traditional healers. Most albularyo's have various healing modalities but are known mostly for their use of medicinal herbs. We also have the manghihilot or hilot that specializes in touch therapy techniques. They treat sprains, fractures, and other musculoskeletal conditions. The terms used to refer to a specific kind of traditional healer depends on the treatments that they offer. This may be a combination. A healer can be both a manghihilot and an albularyo. A mangtatawas is a kind of a spiritual healer. Most traditional healers are also called mangtatawas, as they are able to perform rituals to diagnose the patient's condition. Through various ways, they are able to identify the cause of the illness and advise on the necessary treatment. For instance, a patient who is feeling dizzy or bloated, and we call this in Filipino nabati or greeted, could be advised to return to a person they had encountered earlier. And that person has to put the saliva on the patient's tummy or on the sole of the foot so that symptoms would go away. So you can see that in that photo on that side. The word tawas is the Tagalog word for alum, which is used by the magtatawas or the diagnosis expert. The tawas is put over the ailing body part and then transferred over glowing ember. When the crystals start to crack, they are sprinkled over water, and the shape that settles at the surface of the water tells the healer of the cause of the illness. The magtatawas may also use other materials. They may use eggs, pieces of paper, or even molten candle wax. The mananambal is a faith healer who uses herbal medicine along with orasyon or prayers with special intentions. Mananambals are often approached to reverse effects of hexes or spells by mambabarang or mangkukulam. In cases of kulam, Western medicine is of no use. It is even believed that they may worsen a victim's condition. Someone who has these abilities to do faith healing but may use them for ill intentions are called mangkukulam or mambabarang, or equivalent to your sorcerer. The Waray are well aware of the services provided by each traditional healer in their area. They decide where to seek healthcare based on what they are feeling and the symptoms that they have. Let us say they suddenly experience a stomach ache and have been constipated for a few days. They know that they have to see a mananambal because they know that they have been poisoned, or in local language, nalason. Paglalason or poisoning is quite common in the area, and the strength or the potency of the lason is usually tested during gatherings or big parties. All of us solace investigators have been warned against eating food or sharing a meal with people that we do not know because of the cases of poisoning or paglalason in the area. Central to all of these traditional healers' practice is a faith-based ethos which is anchored in both animism and Christianity. Philippine traditional medicine is believed to be tied to the world of spirits. The Philippines' mythological landscape includes dwarves, spirits, elementals, ghouls, shapeshifters, and we believe that these are among us and may cause us pain. But Philippine traditional healers also turn to fundamental Christian principles and encourage their patients to pray. Some carry with them medallions that serve as amulets, protection from harm, and they also believe that some religious artifacts and sites are miraculous and even carry out pilgrimages to worship these. In the homes of the two most popular albularyos or traditional healers in northern Samar are altars. Next to the images of the child Jesus and Mary are their potions and concoctions. that they have prepared for specific ailments, as they believe that proximity to these images make their gamot or the medicine or the potions even more potent. Mana Esther is a very popular albularyo in the Lauang area, one of the Solas hubs. She figured in many of our ethnographic stories and is believed to be the best albularyo in the Philippines at current time. Mana Esther's popularity and efficacy in healing is so widespread that people line up to see her in her small hut. You will see in the photo on the right, queue numbers. And queue numbers go up to 200. She attends to even patients who are not in the country by way of praying over their names or over people that are in her vicinity that are supposed to represent her. So it could be that my husband is sick, but my husband is far away, and she would pray over me instead of my husband. She attends to all sorts of concerns, from skin rash, snake bites, removing tumors, breaking curses or hexes, and even requesting for intervention for examinations. So people would ask her to bless pencils, passports, to get visas for their travel, all sorts of things. Mana Esther checks her patients by pressing the patient's ring finger. She can tell what is wrong with the patient by simply feeling the pulse from a fingertip. Community members have also expressed that preference for traditional healers can also be very practical. They are more accessible than hospitals and doctors, distance-wise, and allow villagers to better manage their resources. Traditional healers do not have fixed rates, and in fact, do not expect payments. Patients pay what they can, when they can, and may even bring gifts instead of money. Formally trained physicians and traditional healers coexist in the community. Two of the albularyos that we have encountered are quick to tell us that when patients come to them and they know that they cannot cure them, they advise these patients to see a medical doctor right away. There have also been cases where patients who have been in the hospital for a long time but are not seeing improvements in their conditions decide to see a traditional healer. There are cases of supposedly miraculous healing, and patients are able to bounce back from very serious condition right after seeing an albularyo. There are success stories, but this cannot be said of all instances. Doctors in Northern Samar are aware of the patient's patronage of traditional healers, but doctors also express skepticism of this practice. Barangay health workers or BHWs are village members who voluntarily provide frontline care in their communities. BHWs are not doctors nor nurses. They did not receive formal training in medical education, but when they go on household visits, community members ask for their advice and even consult them on what medicines to take. The BHWs are considered as frontliners in the provision of healthcare in the Philippines. Among the tasks of the BHWs are to provide first aid, equipment sterilization, collection of vital statistics, and preparation and updating of reports. BHWs also assist in immunization education, monitoring and dispensing medicine. And in my conversation with BHWs, who were mostly females, many of them have shared that what they feel is their most important task is to look for pregnant women. In our language, maghanap ng buntis. In one of my first field rounds in Northern Samar, it was the barangay health workers or the BHWs who introduced me to various traditional healers. We could say that the BHWs are operating at the boundaries of the three healthcare sectors. In summary, medical pluralism in Northern Samar is part and parcel of everyday life. The Waray do not consciously distinguish between the professional, popular, and folk sectors of healthcare. Important also in our mapping is the complex categorization of healthcare, especially of the folk sector, and the different traditional healers operating within them. Thank you very much.